So welcome to Georgetown University's Lombardi Comprehensive Cancer Center here in Washington, D.C. And I am very pleased to introduce our team to you and to give you some of our insights and share our experience, if you will, around the management of patients with metastatic refractory colon cancer. So welcome everybody. Welcome to Georgetown University MedStar Cancer Network here at the Lombardi's Comprehensive Cancer Center. And I'm joined by this fabulous members of our team who are going to share some information. First, Monica Chacha is a nurse who works with us day in and day out in making all the machines run. Welcome. And Dr. Mohamed Salem, who's one of our newest partners in the team, who's made a dramatic impact on cancer patients and clinical research. So thanks a lot. I wanted to sort of start by talking a little bit about our center. So it's a big, busy center, as most comprehensive cancer centers are, in the middle of a city. We see nearly 1,000 new GI cancer cases a year, and we're only the tip of the iceberg of a really large team. And we focus not only on basic clinical care, but also trying to do cutting-edge research to try and change the way outcomes come for patients with colorectal cancer and other GI cancers. But first I want to talk a little bit about who we're representing, and maybe Monica first. I mean, other members of the multidisciplinary team that we rely on day in and day out.
Sure. I think some of the people that help me most in my responsibilities are nutrition. We refer people to nutrition almost every day, helping with things like eating through nausea, eating when you don't feel like it because you have to maintain energy when you're on chemotherapy. And then another person that is really a good resource is our social worker. Our social workers are some of the people that I go to the most. They help with arranging home health care. They help with referring to maybe support programs or even anything like that.
Yeah. So I was thinking about other nurses too. I mean, you're the mother for a lot of these patients and take care of everything, but so many other nurses touch them through the course of their treatment. So.
Yeah, absolutely. So, I mean, we have our nurse practitioners that sometimes they'll see in the clinic along with the physician, and then another really important part is the infusion nurses. And these are nurses that they see almost every week that give them their treatments, talk to them about labs, they do education as well. So.
Dr. Sam, other key members of our multi-D team.
No, I totally agree, and I think I would steal your quote, like it's a team sport. So cancer care is very complex, and you can imagine when patient get diagnosed with colon cancer or any cancer, in fact, it's like the most stressful news patient can get. And to be able to navigate through this process from the time they call for appointment until they get their first infusion treatment, it's a very complex process. It starts with patient navigation. So call for the appointment, get the record, and so on and so forth. Even knowing how to come here is a barking process.
But sad but true, yeah.
But then you come here and you have the medical oncologist, you have the nurses who play a huge role in the care, and then even like for the follow-up scans, for the blood test, where do you go, the nutrition, the pain management team, so on and so forth. I think it needs a village, as you say, to take care of that.
Yeah, and we're so blessed. We have incredible interventional radiology and surgery. I mean, just today we needed somebody to get a paracentesis this morning, and they're there to do it for us right away. So the surgeons, radiation oncology, interventional radiology, all critical to the successful management of a patient with colorectal cancer. I was thinking about colon cancer patients in general, and they're young, they're old, they're men, they're women. And they have some unique issues, and we take care of different kinds of patients with GI cancer. So maybe, what do you think? It's something unique about colorectal cancer patients that we see and notice?
Sure. No, I think it's one of the aspects in colon cancer is very close to my heart is actually the colon cancer in young adult. Because I think colon cancer itself cause a huge impact on life. But also being a young adult, it actually adds to that layer of stress. For example, I had one of my patients who had like 35 years old and was diagnosed, and then she had a daughter like 12 years old, and she was asking me to arrange her chemo infusion to match where she,
Yeah.
where she want to take her daughter to school or bring her back home, and her husband has to take off those days, and so on and so forth. So I think it actually make it very challenging, and us as a team, we have to listen to them and to understand like really what they need, what they look for, and try to adjust as much as we can our treatment and our plan to their needs.
Yeah. Monica, your side on that? Anything unique about these folks?
Yeah, so I think, we're dealing with people here who, number one, they're trying to maintain their lives, kind of like he said. They're trying to work, or they're trying to still go on vacation, or still spend time with friends and family. And then at the same time, these same people are having to come to the hospital once, maybe 2 times a week.
Yeah.
And then dealing with all the side effects,
And wear that damn pump.
Yeah, exactly. The 5FU pump. Can they go to the grocery store with it? That's the question I always get. Am I allowed to leave my house with the pump?
Yeah.
So, yeah, they have a lot going on, a lot of things that they're
And they live a long time, right? So they are going to be our patients for a long time, hopefully longer still. So they bring a lot of unique characteristics. So busy center, patients living longer, takes a big village to take care of all of these patients. That's the secret to the most success for treatment of colorectal cancer.
Education is so important, and it's a huge part of my role as a nurse. That is really sort of the main thing that I do with patients. Another thing that I really do is try to, create a rapport with people. And in the end, I have a lot of patients that say we're almost more friends than we are nurse and patient. And I think that relationship there is very key for me, because it gives me kind of an inroad to be able to speak with patients. A lot of times they're going to have an open ear to what I say. They only may give a snippet of the information to the physician, whereas with me, some patients, I'm literally talking to them every day, sometimes even a couple times a day. They're updating me with how they're feeling, what's going on, and that's just a really good relationship for me to be able to talk to them about side effects.